Families who receive Medicaid coverage through ARKids say that their children are paying the price for delays in the state's computer system upgrade. KRK Working for You is Marcy Manley hears from a mom who has spent hours on the phone with the state trying to get her kids' approved insurance activated as doctor bills are being turned over to collections.
Jessica Parson
Hello. Thank you for calling the Lee County Department of Human Services.
Has called the Department of Human Services
Please hold.
roughly 3 times a week since August.
I was calling to check on the status of my children's Arkansas kids.
Her children have received health coverage through the ARKids program for the past decade. ARKids is the state's version of Medicaid coverage for children to make sure kids receive medical care if their families meet income qualifications.
I've never had the problem. My oldest son's 14, and they've been on it since they've been born.
But this year, something went wrong, despite DHS telling Parson her children were eligible.
They're approved, they have the same number, but somebody can't hit a switch button.
Now, 4 months later,
I understand you frustrated because of your ARKids for your children is not active.
she's still waiting for 2 of her 3 kids to get the green light.
Send it up to Little Rock, and for right now, we don't have an answer.
Even though one of her children was approved and moved on.
You're not getting a runaround. We're telling you the truth.
Act it's like somebody don't know what they're doing. What is the holdup?
Is that acceptable?
No, it's not. That's too long for us. That's not the process that we set up.
According to DHS, this summer it began transferring the ARKids program from the 25-year-old computer system to the department's new software, which hasn't gone as smoothly as it had hoped.
I imagine it would be frustrating for parents because in this case they did everything they needed to do.
According to DHS, the problem the Parsons are experiencing has impacted about 200 other families, with an unknown error keeping the profiles from registering as active.
They're literally just having to go in there and look at the data files to try to find an anomaly that caused the error.
Locally, DHS confirmed to Parsons she wasn't the only one dealing with delays.
It's not up and running like it should.
But it's hurting the kids that needs to go places.
And I agree. You're not alone.
But DHS on the state level saying some of the frustrations parents are experiencing may be local offices failing to appropriately follow the process.
But we'll be reaching out to our staff again to ensure that they know the process for escalating these cases to ensure they're handled quickly.
According to Parson, doctors won't set appointments for her kids without insurance showing the accounts is activated or her paying appointment costs she can't afford.
Unless we pay the $120, $30 payment plus payment of prescriptions, then we don't go to the doctor. They won't see them no more.
When a serious health issue for her daughter arose in September, the emergency room was her only option.
The ER visit and one is the doctor's bill.
DHS reassured her the trip would be covered retroactively, and the hospital informed of the issue with ARKids. But she's being stuck with the bill now.
Medicaid saying it's all going to be covered. It's just when they get ready to activate them.
Does that do anything for your credit now that you've been turned over to collection?
No.
Parson, as a working wife and mom, has begun to feel the frustrations pile up.
Been working on them and trying to fix the problem, and you're not alone.
She's left waiting on the other end for a resolution to get her kids the basic care they need and are already approved to have.
Marcy Manley reporting. If you have a story you believe needs KRK Working for You, contact Marcy Manley through our tip line 501-340-4448 or send an email to workingforyou@krk.com. Right now at 10:30.